In this video, I will tell you about 7 rules for quick and effective treatment of severe respiratory viral infection, simply acute respiratory viral infection. These methods are equally suitable for adults and children. And the rules are based on the principles of the immune system's work. And if we help our immunity, not harm it, then health will not make itself wait. So, the first rule, it's about creating optimal conditions that surround us, so that our immune system can function properly. And above all, our local immunity protects us. On the border of our environments, on our mucous membranes, which are the first to come into contact with viral particles. And I will never stop reminding that the more moist our mucous membranes, our respiratory paths are, the better our local immunity works. Because our immune cells and antibodies, they also float in this mucus that covers our mucous membranes. And the more antibodies and immune cells in this mucus, the better the local immunity works. But if the mucus becomes viscous, then immune cells and antibodies get into it poorly, and they practically do not move there. Therefore, create conditions in your homes so that the mucous membranes do not dry out. The temperature should not exceed 21 degrees Celsius when sick. Humidity should not be less. You can lower the temperature by covering the heating radiators, and you can increase the humidity with a humidifier. If you don't have a humidifier, you can wet towels, hang them on the radiator, and thus you will increase the humidity in your room. But be sure to observe these 2 conditions, temperature and humidity, in order to recover faster. Rule number 2, drink as much fluid as possible. It's better to drink regular drinking water. This principle is based on the fact that the more we drink, the more moisture is in our body, and the more moisture gets on our mucous membranes. And the mucus, in which antibodies and immune cells float, which covers our mucous membranes of the respiratory tract, it becomes moist and creates optimal conditions for these antibodies and immune cells to float in it and protect us from those viruses that enter our body. Also, if we drink a lot of fluids, our blood will filter faster and toxins will be flushed out of it more quickly. These toxins will be excreted with urine, because we know that the more we drink, the more we urinate. So we drink water and get rid of intoxication. Let's move on. To enhance the first and second rules, we can additionally moisturize our mucous membranes, or with the help of sprays with seawater, which we can spray our nose, even spray our throat. There are sprays with seawater, including for the throat. Moisturizing can also be done with the help of an inhaler. Compressor ultrasonic inhalers are best for this, into which you can pour either saline mineral water, for example, from a Sintuki, or ordinary saline solution. And if you additionally moisturize your mucous membranes, then you already know that your local immunity will work much faster and more effectively. Rule number 4. You can't lower the temperature below 38.5 degrees. You can't lower the temperature below 38.5 degrees. Why? Because today we are talking with you about the acute respiratory viral infection. And the antiviral immunity is fundamentally different from the immunity that fights against bacteria. And interferons play a very important role in the fight against viruses. These are substances that slow down the intracellular development of the virus and improve the penetration of immune cells into the foci of inflammation. Therefore, in order for our own interferons to actively form, the body raises the temperature. Therefore, if you have symptoms of acute respiratory viral infection, please bear a little and do not bring down the temperature below 38.5 degrees. Rule 5. This is the use of antiviral drugs. There are very heated discussions on this issue because half of the specialists believe that these drugs do not work and this is a waste of money. Half of the specialists believe that this must be done and antiviral drugs must be prescribed. In my practice, I use antiviral drugs, but not in all cases. As a rule, I prescribe these drugs if the patient has a high body temperature, if he has symptoms, for example, of the flu, for which there is an antiviral drug, the effectiveness of which is really proven. This is Tamiflu. In this case, probably, there will be proven and effective benefit from them. I also prescribe antiviral drugs to children who have allergic rhinitis because their immune system reacts incorrectly to viral particles and certain allergic reactions occur, which lead to an intensification of the runny nose and conditions in which the virus can be in the child's mucous membranes for a long time. Therefore, to children with symptoms of acute respiratory viral infection from the first day who have allergic rhinitis, I prescribe antiviral drugs. But I don't prescribe them for a long time. 2-3 days is enough because the main mass of these drugs are either interferons or interferon inducers. And we know that 2-3 days after a viral infection, our own interferons start to form. So if I do prescribe these drugs, it's for 2, maximum 3 days. Rule 6. This is the use of vitamins that viruses are afraid of. And recently, especially in the fight against the coronavirus, 2 vitamins have highly recommended themselves. This is vitamin and vitamin. I recommend adults to consume vitamin in doses of 3,500 to 4,000 units of action. We select the dose for children depending on their age. I prescribe adults 1,500 units of vitamin C. We also select the dose for children individually. I recommend taking these vitamins for the duration of the illness as long as symptoms are present, but you can continue to take the vitamin for a long time, especially in preventive doses, to support your body and to maintain your immunity. Rule 7. This is the mandatory treatment of additional symptoms of acute respiratory viral infection. For example, a runny nose, sore throat, earache. Many patients, for instance, do not treat a runny nose during acute respiratory viral infection. And indeed, in some cases, this is correct, because if the patient is fine with the work of the local immunity, if he does not have any chronic problems with the nose and throat, then his runny nose will actually pass by itself. But if your nose is often restless, your throat often hurts, otitis often occurs, then the ear, throat, and nose with certain symptoms definitely need to be treated in order not to get complications. You don't need to wait for purulent discharge to appear. Remove the nasal edema, remove the inflammatory process, wash out the excess viruses, excess microbes to reduce the antigenic load. If your throat hurts, start rinsing your throat with safe antiseptics and using local remedies, for example, based on lysozyme. If your ear starts to hurt in this situation, it's probably right to see a doctor in order to choose the optimal treatment. Because the ear is an organ that needs to be treated effectively and efficiently. In any case, I always recommend my patients to treat symptoms related to the nose and throat, maybe even without any chemical overload. But I definitely prescribe some minimal medications. Treat acute respiratory viral infection correctly, and then everything will be fine. You will recover quickly. See you. Bye.